what he is saying is, we want to help the situation you have exposed the National Assembly to. That's why I didn't see the reason why we should. If you don't understand, calm down, you will be explained to get it right. You have a gap to recruit. You have fund for personnel to engage new service. You ended up not engaging in some few circumstances because of the inavailability of the professions that you are looking for. Again, people exit based on your testimonies. We don't see it in negative. That's what he said. Some retire, some resign for a better job elsewhere. There is a provision for those resources. The last mandate of this committee is to find out, in civil public service, staff that are leaving the service, what happened to the provision of the personnel cost given to them. We know it may not be within your powers to tell us, but we need those details. In my institution, I used to have 200 nominal role. Now, as a result of retirement, resignation, for whatever reason, I have 150. Then you have a budget provision for 50. Let's know that you have that gap pictorially. It will help us in asking government to give you a better guideline and condition to cover those gaps. One. Two, it will equally help the National Assembly to trace where the taxpayers' money is being mismanaged. Because you will see some institutions have those funds. They are not returned to government treasury at the end of the day, either by a supervisory ministry that is responsible for payment of salaries in this circumstance, or by some agency. So this is what he's talking about. Give us those information. In addition to the submission you have made, it will go a long way. And another person had earlier said, make presentation in written to us. Some of this, we will be interested in solving problem than identifying problem exists. We have identified you don't respect federal character, but you have equally given us reasons as to why those federal character will be difficult to exist in public institutions. It's left for us now to see how we can come up with a position by the National Assembly that will be able to save us from those increasing problems that we are facing in the health sector. Honorable Jallo.
Mr. Chairman, my question is, in your submission, you made mention of the, why is it so? Is it by law or by any law established by the federal character? Secondly, my second question has to do with the brain drain the earlier speaker spoke about. If we have such kind of brain drain in Nigeria, and every day, in every state, you see private hospital or clinics being opened, and are either being managed or owned by the same people working at the federal government hospitals. Those private hospitals or clinics are being owned or managed by doctors running government hospital or clinics. What has the institute, what has the body done to checkmate that? And every day are complaining of brain drain. Thirdly, you mentioned that some health workers are about to go on strike. It is strike the last option to solving problems with government. Whenever you hear other doctors, nurses going on strike, it is the last option. If government is doing its best in one way, and you say doctors are trained to save lives, if we are trying to save lives, why strike the last option? You go on strike when people are dying in the hospital. Thank you.
I'm Amina Jomodora. Mr. Chairman, I've listened to them, and being a former Commissioner for Health, I concur with most of the challenges they outlined. There is a lot to be discussed as per the health challenges. The issue of personnel, it's real. Mr. Chairman, most of the local governments in Nigeria, 774, you hardly find, not all, a medical doctor or a nurse or a midwife. So there are a lot of challenges that I think we should have time with this gentleman to discuss intensively to find the solution. Yes, we might have a waiver. I had such waiver when I was Commissioner for Health. I went as far as Egypt. I recruited doctors. Because as I said, hardly they stayed 3 months. They went back for so many reasons. And those reasons need to be addressed and discussed as a nation if we want to move health sector. There are a lot of challenges, and I think, Mr. Chairman, another forum could be in place to discuss intensely with the doctors and the whole health sector. You can build a hospital, you can equip it, but the challenges are in the human capital. And that is a challenge in every local government and every state. Thank you, Mr. Chairman.
Thank you. Now,
I also want to appreciate and be on the same page with the directors of the medical centers. My background as a federal commissioner and a federal crime commission also made me to understand the points they raise. But I also believe that they also have something they call a window, which we call the locum staff. Am I right?
Yes, sir.
Yes. I will want the various medical directors to submit separately the list of the local staff engaged in the federal medical centers to this to this committee separately from the normal personnel. Thank you very much, Mr. Chairman.
It's not really a question, so to say. What the CMD has highlighted to us is very pathetic in a country like Nigeria. And my chairman, part of the responsibilities of this committee is to seek for solution. I would like to ask the College of CMD seated here, what will they recommend to the legislative arm of government by way of lawmaking in order to mitigate most of the challenges that is currently bedeviling the health institution in Nigeria? Thank you.
Honorable Chair,
the chairman of the CMDs, your submission where you were analyzing the OT, you made us to understand that you normally get waivers before the recruitment. And you couldn't make us to understand that the professionals are not available, more than much available in your locality. Instead of getting waivers, I believe, according to the Act, you're supposed to announce in at least 2 national daily newspapers for whatever you want to do. Instead of getting waivers, why can't you people be going through this way by advertising all this recruitment exercise so that people from other states can equally key into it and apply for this employment? That's just my submission.
Mr. Chairman, if you so allow. My comment is we are all in agreement that there is serious brain drain, if I can call it that, in the medical sector. And we have very few medical professionals that have agreed to stay back in Nigeria to offer services to our communities and population. Thank you for those that have stayed back. I want to commend you. Secondly, we are all aware that the Northeast geopolitical zone, the Northeast region, especially Yobe, Borno, Adamawa states, have been hit seriously with insurgency over the last years. And that has seriously affected medical institutions. So many professionals have left, and just a few are left behind to oversee those institutions. Is there anything the body of CMDs is doing to assist those health institutions in the Northeast geopolitical zone that has been hard hit by insurgency, at least to fill gaps in those institutions so that they can be above, above board in providing such medical attention to our teeming population. Thank you.
The chairman and honorable members. There are a lot of questions. First of all, I want to say that we have to admit there are challenges and even infractions in our part. We are not, we're not totally above board. I would say that some of these things are not because of greed, but because of expediency. Every chief medical director wants his hospital to function. He wants to provide services judged by service provision. If anybody comes and things don't work, you are usually taken, you have to take responsibility. That may be responsible for some of the infractions. But let me go straight to the question, sir. How do we reduce brain drain? So that is a national question. But what I can believe is that we can also begin to reverse the brain drain by encouraging people to come back to Nigeria. Because if there are reasons why people go out of the country, first of all, it has to do with money, remuneration. Secondly, it has to do with lack of, I would say, equipment to practice. You don't have satisfaction. If you are, let's say, a radiologist, you would want to have MRI, CT scan, high-tech equipment because you're reading about the developments. So if you have an opportunity to go to a place where you can earn much better, and then you have the equipment and learn, I'm sure you would.
This is where I have little problem.
Yes, sir.
I'm sorry to interject you. It is within my right to do that on behalf of the committee. The response is quite unique. A representative of the people, we admit responsibility. But I like this conversation. I am lost. If I admit too that there is lack of advanced medical facilities in our health sector, this is a fact. Take it or leave it. And we must, as government, pay attention to that. But where I'm confused, we are confused, is in a situation whereby it's the aspect of lack of patriotism. I am trained under the tree in a Nigerian primary school in Gagdibi Primary School. I should have passion to add value to the country that trained me in that circumstance than looking for something better than. You are produced by Nigerian institutions. We admit the brain drain. We admit the gap. We are trying to find solution. We are happy to see all of you here. A lot of you have the connections, maybe based on the value of your intellect, to be in the developed countries and provide services to them. But most of you find fashion in adding value to your own motherland and fatherland. Why are these people? Can't you? I think in as much as there is admittance, like you admit you fail in the area of respecting some extant rule in providing employment opportunities and what have you. On behalf of government, National Assembly, we admit failure on the part of government to do what is right to our health system. But let's balance it, let's meet somewhere. What are you people telling your co-professionals about patriotism? About giving back to the society that gave you the knowledge. You are not trained by law UK, you are not trained by USA, you are trained by University of Jos, University of Maiduguri, University of Lagos, University of Ibadan. And you would want to take the value of what that poor university have impacted on you to go and give other country. Where do we place that? Let's move forward.
Problem which you've highlighted, but we can actually attract some of these people who have gone out to come back, especially the ones who have practiced for a sufficient number of years, especially in Lagos and some Abuja. Many of them are coming back, and they are, if they could have a pathway for some of them who have maybe left the country, for greener, but want to come back to be reabsorbed into the service, I think that could happen if we can have that pathway, create that pathway.
As your representative, we will tell government to bridge that gap. In infrastructure, in modern medical equipment, I assure you, watch us in the 10th Assembly. We will put that clearly in 2024 budgets to the federal government. But we equally challenge you to throw to your own profession the issue of morality. You cannot disown your father no matter how poor he is. For Nigeria produce us as medical doctors, no matter the rots within our public sector in terms of remuneration. Let's work together and see how we can find solution to that. But let's remain in Nigeria to serve our own country. Address some other questions so that we close.
Yes, have strictly abided by the waivers given to you. When you're given a doctor, you take a doctor. If not so, the challenge is that you will not get, the clearance, and you will not. Maybe there are one or two institutions who may have done that, but it's not a general practice. Because in recent years, the emphasis has been on, I think in the last few years, they're only giving waivers for medical staff. Yes, 70-30, 70% will be medical staff. But then that does not, we also need to realize that even these non-medical staff are still critical in the hospital ecosystem. I mean, most of us run on generators. If you do not have the engineers, the technicians, you don't have the ambulance drivers, you don't have the accountants and all that, they're still important. Most important thing is that we should ensure going forward, like what is happening, that most of the staff that we employ are medical staff. On the issue of documentation, so I would say that most of us have submitted, we have very large bags. The documents have been submitted, what you require to the Secretariat. We will inform our people to submit the soft copies for easy analysis. So every hospital will submit the soft copies of that documentation within the next 1 week, sir. That will be done. On the issue of federal character, less than 200 waiver. I'm happy, Honorable Ishak, I think he's left. He was here. He was in the Federal Character Commission. We did not create that. We came to meet that system. But sometimes it helps, because I would say that for the non-medical staff, where you have 5 positions, let's say you are given 5, already in your pool you have over 200, 300 for that same position. So if there was no regulation, let's say you have to recruit 30, 40 persons, you may end up having to interview thousands, especially for the non-medical staff. But then we did not create that rule, sir. We came to meet it, and we know it's within the purview of your committee to address that, sir. On the private hospitals being owned and managed by doctors, sir, there's a rule that regulates private practice by medical doctors. Unfortunately, that is not done by our committee. It's done by the respective state governments and the ministries of health. But I would say that it is not entirely bad, sir, because many of the people who have stayed behind because of the extra income and responsibilities. And indeed, it's a stopgap, because in some places where you don't even have government facilities functioning, those private hospitals have become lifesavers. But the most important thing is to ensure that there's a proper regulation, that doctors and health practitioners do not use government time to go and do their private practices. We try to regulate our staff to the best of our abilities, and we will continue, sir. On the strike option being strike the last option, I agree with you, strike is the very last option. But unfortunately, it appears that over the last decade or so, we have bred very restless young men and women. So we're going to have that conversation to sit down. A strike, it should be the very last option. But one of the things we've seen has been the fact that we see threats and threats and threats. And instead of, I would say, governments in the past sitting down to negotiate resolutions that are, what is the word there? That are feasible. Just because you want to end a strike, you have agreements that you cannot implement. And then after a certain period, 6 months, 1 year, you have not implemented, the people now go on strike. So we need to sit down together. And I agree with you, comparatively, the health sector is better than other sectors, even though a lot more could be done. And that is where we appeal to patriotism and every other thing to ensure that we can mitigate the strikes. The list of locum staff, we would submit that, sir. But just to note that we have non-regular staff. These are usually interns. interns who come in for 1 year and then they leave. And then many hospitals, to address the gaps, for example, you're looking for ICU nurses, you have to resort to contract staff. Because where you cannot find, like my colleague pointed out, an ICU nurse who is, if somebody retires at 60 and is still strong, it's best to take that person on contract. And also, if you need maybe a health professional and you cannot do the normal recruitment, you have to wait and you have some money, it's always preferable to take that person on locum. Locum is basically a stopgap. It's not the solution, sir. Well, so the recommendation into the National Assembly in a law making to mitigate the challenges, I think we will put our position paper as a committee. You know, some of this are on, but one of the ways which has been recommended is the one-on-one replacement policy, which we hope. In that one is that somebody goes, let's say a doctor leaves and there's a gap. So we are asking for possibly, it's a complex process which has to be worked out through the Ministry and Head of Service for you to immediately be able to replace that doctor using his same IPPIS number, and you know, so it's something that we're still, it's in the pipeline, sir. So we're working with the ministry and the Head of Service, and I hope sooner or later that can, because that would help to address in the short term some of the gaps. 10 people leave, you replace the 10, but they must be people of the same cadre, health workers, and you do not take other people. On the issue of where our salaries, that for people who leave, go, that the surpluses of salary every year, I would say, sir, we don't have any control. That is usually mopped up. You have every year, you have your personnel, and the personnel is totally controlled at the IPPIs. We don't have any hands in terms of payments or so. We just send the schedule. When they do that and then they pay, whatever is left, sir, the government mops up. Government mops up almost on a quarterly basis, any surplus money. And that goes back into the government coffers. So we do not keep government money.
I think you are answering a question that is not meant for you.
No, sir,
I can give you, you say they are mopped up back to the government coffers.
Yes, sir, in our hospitals.
Okay, in the hospitals.
Yes, in
the hospitals, I may agree, pending on the outcome of this investigation.
Yes, sir.
But in other agencies, I will disagree, because we have seen reports from agencies where you have a year and it's not normally refunded to the central pool of government.
No,
so, but in the hospital, by the way, do you control your payment in IPPIS?
No, sir.
So why are you speaking for IPPIS? The desk officers are listening to you. Maybe he is exonerating you when we call the director of IPPIS.
No, sir.
There is no point.
We don't have any control over
So leave us to engage them with that, to ask them what we need from you is the gaps. Give us the records of, for instance, in 2023, 10 staff retired from your own institution. 7 resigned, that is 17. Just write those figures to us based on your own institution and submit to us. It's left for us to call the regulating authority that paid those money to tell us these people have this record. From this month, so person have left university, teaching hospital, Akwa Ibom or wherever. How are you managing the resources? Where have you taken them to? But for you, I think, don't go there.
Thank you, sir. So the very last question was not do anything, because the issue is security. We have had some of our members, kidnapped. 1 or 2 have been, usually that is beyond us. But I would suffice to say that as a body, if our security is guaranteed, institutions that are rich in manpower, because that's what I see outside the country. You may see a specialist having to go to 3, 4, 5 institutions to offer service. We are willing to do that, but then our security must be guaranteed. Thank you very much, sir.
Thank you. Those institutions that have pending recruitment cases, we will interface with them uniquely. Those of you that don't have, will look into your issue. You have a very good defense for not having a balanced sheet in terms of federal character. Nigerians have listened to you. So whatever this committee at the end of the day recommend to government, it is going to be done, and it is for our own good entirely. Our interaction with you seems to be different and unique. Why? Because we appreciate what you are doing. Otherwise, like you, some of us, our eyes are naturally red. we would have engaged ourselves in that perspective. So thank you for coming, but we are not done. We have a technical secretariat that are going through this report one after another. We will review them entirely, and where we need to call individual institutions, we are going to do that. Going forward, in having a recommendation that will impact on your modus operandi, we will equally call the leadership of this to have a parley in respect to other institutions that give you approval, so that we will come out with a standard in terms of our recommendation where you will not be suffocated in discharging your responsibility. We assure you of that. On waiver, you've been mentioning, waiver doesn't exist. If you check the federal character is a creation of the National Assembly, including your own institutions. They are creation of the Act of the National Assembly. And so, from page 1 to Z, I have not seen where waiver exists in the Act establishing federal character. It was a convenient creation to suffocate Nigerian people so that some few persons will get the waiver, decide to allocate slots to their own families and what have you. And by the special grace of God, write this and keep. From this committee, waiver is gone. Let Nigerians have the opportunity to showcase their potential. We may give, not exception, some certain clauses in our own recommendation that will allow sensitive institutions, like you say, one-on-one. If someone leaves now, another person comes immediately for health-related institutions and what have you. But to say that waiver should be granted, there is nowhere. The law doesn't even exist for waiver, let alone saying if it is above 200 or 50 or what. There are certain numbers that, don't worry, even in surgery, for some certain reasons. But the aim of waiver has been defeated. It is not being used for the purpose. It was created perhaps for institutions like you, exigencies. You have few slots, 20, 30 to fill, instead of going through the rigors of publication, this and that, giving this, calling for this, you do it indoor like what do you call it in tender? Selective tenders. So it has become something else. And we have no reason why, since it is not provided for in the Constitution, in the Act establishing federal character, I believe you me, this committee will stand firm to ensure that that recommendation is approved on the floor and communicated to agencies that are granting waiver, so that going forward, we will not have any reason. Our concern is nepotism, to address nepotism. Our concern is to address corruption, where people capture who they want to capture and leave salaries of civil servants. Instead of you collecting 10,000, because of your connection with the paying authority, you get 20,000 also. So we'll address all of these issues for the good of this country. We thank you for coming. I hope you have taken note of all the documents that we expect you to give us. On a final note, your nominal role. If you decide to hide nominal role, it's your own business. But we know at the end of this investigation, there will be forensic auditing by the federal government. So the nominal role we will give federal government is the one that the forensic auditor is going to use to audit your institution. If you hide, you are hiding people that are not going to be recognized as public servants. So the earlier the better we do, you check the submission you have given this secretariat and you update it, the better. We wish you well, we wish you the best, and we wish you will preach the concept of patriotism to the younger generation, so that we'll be patriotic. We can blow our trumpet. We are on recess, but this committee has been sitting for days. That is patriotism. For weeks. instead of you to go for holiday. So it's just like you getting your annual leave and you decide to stay in the hospital. So let us show some certain level of patriotism to the country that have made us who we are. There is no doctor that will operate in US, UK, that it is not Nigeria that made him, unless if he is trained from there. And we won't even talk about you if you are not trained from Nigeria. If you are trained from UK, stay in UK and work there. But so as long as the unkept classroom of Nigerian university produce you, give back that commitment to the country that made you who you are. We wish you well. We are not done. I repeat, we are not done. We are not done. Where we need to, we are studying the institutions one after another. Where we need to write and invite you back, we will do that. But this is one of our best sessions. We have learned. You have equally learned. Particularly the guilt of patriotism and the guilt of lack of basic equipment on the part of government. It's a win-win situation. Thank you. Thank you.
Thank you, sir. So, in 2016, NISA essentially is a research institute established to conduct research into the socio-economic problems of the country. And
when first you recruited, when?
We recruited in first. 2018 and 19.
Okay. Did you advertise?
Yes, sir.
Bought the two?
Yes, sir.
I've seen the notice. That's why I'm stopping your presentation.
Okay, sir.
Any recruitment that I see advertisement that is not waiver, I become comfortable with. That's why I want to be professor. Even though you are not the one that did that, it was perhaps a different accounting personality, yes. DG, yes. But they have done advertisement, yes, for Nigerians to. Then the last was when?
2019.
Do you have the staff summary of your state-by-state representation of your nominal role?
Yes, sir.
Where? Which page?
We have from 2015 to date.
Okay, the nominal role.
Yes, sir.
But have you analyzed from which states and states are they?
Yes, sir.
Where? Speak
For
to that
example,
page. Give us the summary of state-by-state representation. Give us the summary of your manpower gap based on your retirement. And give us a summary of your establishment needs. This is what we need. Okay, but for instance, you need 200, and 100 have already retired. So then it means you have gap for 100 because they are in the system already. You don't need any budget to recruit them. But your establishment need 200, and you have 100 space. Give us those analyses. We will know going forward how to interact with you. Okay. You are from Ibadan. It may be difficult for us to suffocate you. I've had people whisper your agency. Someone came to, not for us to compromise, to give us your profile when you serve as INEC commissioner and a very diligent woman. Your colleague is here, your staff, former staff was here. So don't worry. We may not stop you to come back, but we need those things to make our submission and report very cordial. But we commend your agency too. We would have interacted deep with you for the fact that you have advertised those two recruitment process. It means you are in the side of the law. So we thank you for coming, but remember to give us those ones. And if you have earlier applied to the head of service, yes, sir, requesting for that, we need the duplicate copies of those applications to consider whether some things need to be done.
Okay, sir.
Thank you.
Thank you. Thank you very much, sir.
Chairman.
Yes.
Advertise on the issue that has to do with employment. I don't know why the whole of the content of this submission as regarding the staff of this institution, in every page, all the employees are from Ibadan, that is Oyo State.
What are you?
Can you shed more light why this happened, despite the advert? Thank you, madam.
column that talks about location, where the staff is working. We were merged with the National Manpower Board in 2006, and we inherited their offices. So we have 6 geopolitical zonal offices. So some you will see are located in Akure, some in Bauchi, some in Owerri, some in Port Harcourt, most in Ibadan, which is the headquarters. But it's not that everybody is from Ibadan.
Oh, you are just, maybe he checked the column where the location.
That's what I think.
Thank you. Thank you.
Yes.
By the way, your staff say we should not ask you question, but we say we must ask you question. Jafar said so, but we will give. Is there any agency that is here to make presentation?